Everyone, my name is Rebecca Hayosh. I'm a registered nurse completing Viterbo University's RN to BSN program. The topic I chose to research for leadership was mandatory overtime in nursing. I wanted to discuss the implications for mandatory overtime within leadership. The issue has persisted in healthcare for decades and continues to impact nurses, patients, and organizations. I'll review what the literature says, compare it with my own professional experience, and discuss nursing implications for leadership practice. So what is mandatory overtime? Well, by definition, mandatory overtime is the requirement for nurses to work beyond their scheduled shift. It's not just a staffing issue, it's a leadership issue. Leaders must decide when and how to use overtime while still ensuring safe, ethical, and sustainable care delivery. So I wanted to pose the PICO question. In hospital-based registered nurses, how does the use of mandatory overtime compared with voluntary overtime or alternative staffing models impact nurse burnout, job satisfaction, and patient outcomes? My PICO question guided the literature search that I did, and it frames the discussion around nurses. I wanted to talk about the interventions of what the intervention of mandatory overtime is, and compare it to alternatives and the outcomes for both staff and patients. I searched Viterbo online library using keywords like mandatory overtime, niche nursing leadership. While I focused primarily on recent evidence, I did include 2 foundational articles from the early 2000s because they show how long this problem has been recognized. I selected 4 articles in total, ranging from 2001 to 2024, to capture both historical and current perspectives. One thing I think is kind of fun is that one of my articles from 2000, I believe it's 2010, was also the same author as one of my articles from 2024. So it's kind of fun to compare and contrast her viewpoints at those different parts in time. Bay and Brewer study the impact of regulations designed to limit mandatory overtime. While these laws reduced overtime hours, they did not eliminate the issue. This suggests that leadership presence is key. Nurse managers must interpret policy, advocate for resources, and try to design staffing models that go beyond compliance that actually support staff well-being. Haney's article reflected early concerns from the nursing profession. Many nurses viewed mandatory overtime as unsafe, but leaders often saw it as necessary to cover shifts and to continue patient care. Fleury expanded this with legal and ethical perspectives, warning that mandatory overtime can directly compromise patient safety. Together, these articles emphasize that mandatory overtime is just fundamentally a leadership and ethics issue. That's just an ongoing discussion. I know that in my work setting, overtime has not been mandatory, and I'm thankful for that. It's more of a volunteer and float pool staffed type of model. But I've had friends who've come from other hospitals that had to complete mandatory overtime, and they would sometimes do 16-hour shifts, and I just kind of feel, and I know they felt as well, that once you get past that 12-hour mark, your ability to give safe, competent nursing care tends to become compromised. So something to consider. Bay's 2024 study is particularly powerful because it's current and it uses large-scale data. It confirms what nurses have said for decades. Mandatory overtime fuels burnout and pushes nurses to leave, which worsens staffing shortages in the long term. Leaders who use overtime as a band-aid solution end up creating bigger problems for both staff retention and patient care. And I think there's been a huge discussion surrounding a lot of nurses just wanting to leave the bedside, which is very unfortunate because that's where they're needed most. or just seem to be needed most and where the most turnover is. All right, nursing implications. So the literature clearly shows that mandatory overtime harms both nurses and patients. Nursing leaders need to be proactive, not reactive. So this means using creative staffing solutions like float pools, which I've personally had experience in, and are so helpful. They improve scheduling flexibility and advocate at the policy level for stronger protections for nurses. Equally important is culture. Nurses should never feel punished for voicing fatigue or safety concerns. But if they don't want to continue or work a 16-hour shift, they are often usually there is like an what is the word I'm looking for? Repercussion or a consequence. So in conclusion, mandatory overtime continues to challenge nurse leaders despite decades of recognition. The evidence is consistent. It harms nurses, risks patients' care, and it destabilizes organizations as a whole. Leaders have a responsibility to explore safer alternatives, advocate for policy reform, and support a positive work environment. I'd like to leave you with this question. As a nurse leader, how would you address staffing shortages without relying on mandatory overtime? We talked about some of the alternatives like float pool staffing, incentive pay for voluntary overtime hours. I think these are all good options, but maybe there's a bigger solution out there. I'd love to hear your feedback. And then here's a list of references. Thank you again for your time. Have a great day.